Hey everyone, I'm Dr. Alex Carter, and today we need to talk about something that affects millions of Americans over 50, and most of them don't even know what's happening to them. I'm talking about the silent heart attack. Now, you've probably heard that term before, maybe on the news or from a worried family member. But here's the thing, most people don't really understand what it means or why it matters. So today, I'm going to walk you through exactly what a silent heart attack actually is, how it feels different from what you might expect, who's at highest risk, and most importantly, what warning signs you absolutely cannot afford to miss. And I'm going to give you some concrete steps you can take this week to protect your heart. So stick with me. Let's start with a statistic that might surprise you. Research from Harvard Medical School and the Mayo Clinic shows that about 1 in 4 heart attacks happens with little to no chest pain at all. 1 in 4. That means if you're picturing a heart attack the way Hollywood shows it, someone clutching their chest, collapsing dramatically, you're probably picturing the wrong thing. In reality, a lot of people have heart attacks and barely notice, or they notice something but convince themselves it's nothing serious. They think it's indigestion, or they're just tired, or maybe they slept wrong. And by the time they figure out what actually happened, precious hours have passed. Hours that could have made all the difference. So let me explain what's actually happening in your heart when a silent heart attack occurs. Your heart is a muscle, and like any muscle, it needs blood flow to work. That blood comes through arteries called coronary arteries. If one of those arteries gets blocked, usually by a buildup of plaque over years, blood can't reach part of the heart muscle. When that happens, that part of the muscle starts to die. That's a heart attack. Now, whether you feel that happening depends on a lot of factors, and that's where it gets interesting. Not every person's nervous system sends pain signals the same way. Some people have what's called reduced nerve sensitivity, especially as they age. Your nerves don't fire the same alert they did when you were 30. Diabetes also plays a huge role here. If you have diabetes, especially if it's been there for years, you might have what doctors call diabetic neuropathy. Basically, your nerves don't transmit pain signals properly. So you could be having a heart attack and literally not feel the classic chest pain that everyone expects. Then there's something else that happens after you turn 50. Your body changes. Your blood vessels become less elastic. Plaque builds up differently. Your stress response shifts. All of these things mean your heart attack might announce itself very differently than it did in younger people. And that's why knowing the atypical signs is literally a life or death skill. Let me walk you through the 5 most commonly missed symptoms of a silent heart attack. These are the red flags that most people either don't recognize or convince themselves are something harmless. Number 1 is unusual fatigue. And I'm not talking about the normal tired you feel after a long day. I'm talking about sudden, overwhelming exhaustion that doesn't go away with rest. You wake up after 8 hours of sleep and you're still completely drained. You're struggling to get through activities you normally do without thinking. Some people describe it as feeling like they're moving through water. If you've ever suddenly felt this kind of bone-deep tiredness that's different from your normal baseline, especially if it came on out of nowhere, that's worth paying attention to. Number 2 is shortness of breath without chest pain. This one trips people up constantly. You're walking up a few flights of stairs and suddenly you're gasping for air. Or you're sitting on the couch and breathing feels harder than it should. Some people interpret this as being out of shape or having asthma or anxiety. But when shortness of breath happens without an obvious reason, you didn't just exercise, you're not sick with the flu, that's your heart sending a distress signal. Cardiologists at Cleveland Clinic have been warning about this one for years because it's so frequently ignored. If you notice a sudden change in your ability to catch your breath, especially if it's combined with any other symptom on this list, that's time to call someone. Number 3 is pain or pressure in your jaw, neck, shoulders, or upper back. This one absolutely baffles people because they don't associate it with the heart at all. You wake up with a stiff neck, you think you slept wrong, or your jaw feels tight, and you assume your stress is getting to you, which it might be. but it also might be something more. The thing is, your heart's pain signals don't always stay localized to your chest. They can radiate up your neck or spread across your shoulders. Women especially experience this. Studies show that women having heart attacks are way more likely to report jaw pain, back pain, or shoulder discomfort than chest pain. And because they expect chest pain, they often wait too long to get help.
Number 4 is nausea, or what feels like indigestion. Again, super easy to dismiss. You ate something that didn't agree with you, maybe you have a stomach bug, so you take some antacids and wait it out. But here's what's tricky. Real heart-related nausea often doesn't improve with antacids. It just keeps nagging at you. You might feel vaguely uncomfortable in your stomach or chest, maybe a little queasy. You're not actively vomiting, so you tell yourself it's fine. But if nausea is paired with shortness of breath or unusual fatigue, those 3 things together are a red alert. Number 5 is cold sweats, or sudden sweating without exertion. Not the sweating you get from working out or being in a hot room. I'm talking about breaking out in a cold sweat when you're just sitting down. You feel clammy. Your skin feels cold and wet. This is your nervous system in overdrive, your body's panic response to a threat. Cold sweats combined with any of the other symptoms we've talked about, especially shortness of breath or jaw pain, is a very strong signal to take seriously. Now, here's the key insight. Most people who have silent heart attacks don't experience just one of these symptoms in isolation. They experience a cluster of them. They feel tired and short of breath. They have jaw pain and nausea. They're sweating and feeling weak. If you're noticing 2 or more of these things happening at the same time, or one thing that just won't go away, that's the moment to pick up the phone. Now I want to talk about who's most at risk for a silent heart attack, because your risk isn't the same at 60 as it was at 40, and it's definitely not the same for everyone in your age group. Let's start with age itself. The older you get, the more likely you are to have a silent heart attack if one occurs. This isn't random. It's because of all the changes I mentioned. Nerve sensitivity decreases, blood vessel walls change, inflammation patterns shift. But beyond age, there are specific risk factors that make silent heart attacks more likely. High blood pressure is huge. If you've had hypertension for years, even if it's been controlled by medication, your arteries have been under stress. That stress creates the conditions where plaque builds up faster. Diabetes is another major one. If you have type 2 diabetes, your risk for a heart attack is roughly double that of someone without diabetes. And if you've had diabetes for more than 5 or 10 years, your risk of a silent heart attack, specifically the kind without chest pain, goes up even more. High cholesterol matters too. If your LDL cholesterol has been high, or if it hasn't been checked in years, that's a signal to get it tested. Chronic stress and poor sleep are real risk factors that people don't always take seriously. If you're consistently stressed, if you're not sleeping well, if you're carrying a lot of anxiety, your heart is working harder. Smoking, obviously, is devastating for your heart at any age, but especially after 50. And then there's something people don't talk about enough: being sedentary. If you spend most of your day sitting, if you're not moving your body regularly, your heart doesn't get the conditioning it needs. Now, here's what I want to emphasize. Being at risk doesn't mean a heart attack is inevitable. It means you need to be aware and take action. But I also want to mention something crucial about gender. Women over 50 have a significantly higher risk of silent heart attacks than men. And they're also way more likely to be misdiagnosed or to wait too long to get help. Why? Because the symptoms are atypical. And even worse, sometimes women's symptoms aren't taken as seriously by doctors. A woman comes in with jaw pain and nausea, and she's sent home with antacids. A man comes in with the same symptoms, and his heart is checked immediately. It's not fair, but it's something women need to know about and advocate for themselves on. Okay, so you know what a silent heart attack is. You know the symptoms, and you know if you're at higher risk. Now we need to talk about the most important question. When should you call 911? This is critical. Here's the rule that cardiologists want everyone to know. If you're experiencing any of the symptoms we talked about, shortness of breath, unusual fatigue, chest pressure, jaw pain, nausea, cold sweats, and these symptoms are new or different from your normal baseline, you need to call 911. Not your doctor, not an urgent care, 911. The goal is to get to a hospital where they can do an EKG, which is an electrical recording of your heart, and blood tests that can show if your heart has been damaged.
Now, you might be thinking, but Dr. Carter, what if it's nothing? What if I call 911 and it turns out I just have indigestion? Here's the thing. It's always better to be wrong about this. If you call 911 and they check you out and everything's fine, you're not embarrassed. You've just potentially saved your own life or someone else's life by modeling the right behavior. Cardiologists would rather see 100 false alarms than miss one person who's actually having a heart attack. The window where treatment is most effective is usually within the first 3 to 6 hours. But the sooner you get to the hospital, the more options doctors have to minimize the damage. I also want to talk about something called the call first approach. If you think you might be having a heart attack, don't drive yourself to the hospital. Call 911. Let the ambulance come to you. Why? Because if your condition gets worse on the way, if your heart rhythm becomes unstable, paramedics are already with you with equipment and training. They can also alert the hospital that you're coming, so the team is ready. This saves crucial minutes. And if you're alone and you start feeling really bad, don't hesitate to call 911 before you worry about calling family or neighbors. Your life comes first. Everything else can wait.
Now, let's shift to something more hopeful. Yes, we've talked a lot about risk and warning signs, but the reality is that you have real power here. You can reduce your risk of having a heart attack in the first place, and if you do have one, you can make sure you catch it. So, let me give you 3 concrete things you can start doing this week. Number 1, know your numbers. Go to your doctor and ask for your blood pressure, your cholesterol, and your blood sugar. Write them down. Understand what they mean. If any of them are high, work with your doctor on a plan to bring them into a healthy range. This isn't just about medication, by the way. It's about knowing what your body is doing. Number 2, move your body every day. You don't need to run marathons. A 30-minute walk 5 days a week is enough. Walking is one of the most underrated medicines we have. It strengthens your heart, it helps manage blood pressure and cholesterol, it reduces stress, it improves sleep. If walking is hard for you due to joint pain or other issues, talk to your doctor about what kind of movement is safe for you. Swimming, tai chi, gentle yoga, these all count. The goal is to get your heart working regularly. Number 3, manage your stress. I know that sounds easier said than done, especially if you're dealing with a lot. But chronic stress literally damages your heart. It increases inflammation, it raises your blood pressure, it makes your nervous system hyperactive. So find what works for you. It could be meditation, spending time in nature, time with family, a hobby you love, therapy. It doesn't have to be complicated. 10 minutes a day of something that brings you peace is powerful. And on top of these 3, if you smoke, stop. Talk to your doctor about resources. If you drink a lot of alcohol, dial it back. Eat more whole foods, vegetables, fish, whole grains, nuts, less processed stuff. These aren't radical changes. They're small shifts that add up over time. Here's what I want you to take away from everything we've talked about today. A silent heart attack is real, but it's not a mystery. You can learn to recognize the signs. You can understand your risk. And most importantly, you can take action to protect your heart, starting today. If you're experiencing any combination of shortness of breath, unusual fatigue, jaw or neck pain, nausea or cold sweats, call 911. Don't wait. Don't convince yourself it's nothing. Get checked.
And start this week with those 3 things. Know your numbers, move your body, and find your peace. Your heart is literally keeping you alive. It deserves attention and care. Thank you so much for watching. If this video was helpful or if it made you think about your own heart health in a new way, I'd love to hear about it. Drop a comment below and tell me, has anyone in your family had a heart attack? How did you know something was wrong? Your story could help someone else recognize their own warning signs. And please, if you found this helpful, like this video and subscribe to the channel so you don't miss future videos about heart health and other topics that matter to people over 50. I'm Dr. Alex Carter, and I'll see you next time.